This medication is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It may also be used to treat conditions such as bone loss, weak bones, decreased activity of the parathyroid gland, and certain muscle diseases caused by low calcium levels. It is also used to ensure that certain patients are getting enough calcium, including women who are pregnant, nursing, or postmenopausal, and people taking certain medications such as phenytoin, phenobarbital, or prednisone. Calcium plays a crucial role in the body, as it is necessary for the normal functioning of nerves, cells, muscles, and bones. If there is not enough calcium in the blood, the body will take calcium from the bones, weakening them. Vitamin D helps the body absorb calcium and phosphorus, which is important for building and maintaining strong bones. The recommended daily dosage of calcium 500 Vit D3 varies depending on age, gender, and specific health conditions. It is best to take this medication as directed by your healthcare provider. Additionally, it is important to take this medication at the optimal time to ensure maximum absorption and effectiveness. When taking calcium 500 Vit D3, it's important to take it with food. If your product contains calcium citrate, it can be taken with or without food. Follow the directions on the product package or as directed by your doctor. For best absorption, if your total daily dose is more than 600 mg, divide your dose and space it throughout the day. If you are using the liquid form, be sure to carefully measure the dose using a special measuring device/spoon. Don't use a household spoon. If you are taking the chewable form, chew thoroughly before swallowing. If you are taking capsules, swallow each one whole. Do not crush or chew extended-release tablets. Take this medication regularly at the same time each day to get the most benefit from it. If your doctor has recommended a special diet, it's very important to follow it to get the most benefit from this medication and to prevent serious side effects. Do not take other supplements or vitamins unless ordered by your doctor. There are different forms of calcium supplements that contain different amounts of calcium and vitamin D. Ask your doctor or pharmacist to help select the best product for you. And if you think you may have a serious medical problem, seek medical help right away. Some common side effects of calcium 500 Vit D3 may include constipation or stomach upset. If you experience these effects and they persist or worsen, it's important to consult your doctor or pharmacist. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as nausea/vomiting, loss of appetite, unusual weight loss, mental/mood changes, signs of kidney problems, bone/muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. As for the optimal timing of taking this medication, it's best to follow your doctor's instructions for the daily dosage and timing. Before taking calcium 500 Vit D3, make sure to let your doctor or pharmacist know if you have any allergies to it, vitamin D products, or any other allergies. It's also important to discuss your medical history, especially if you have conditions like high calcium/vitamin D levels, difficulty absorbing nutrition from food, heart/blood vessel disease, kidney disease, certain immune system disorders, liver disease, certain bowel diseases, little or no stomach acid, low levels of bile, or untreated phosphate imbalance. If you're considering using the chewable tablets, be aware that they may contain sugar or aspartame. If you have diabetes, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet, be sure to talk to your doctor or pharmacist about using this product safely. If you're pregnant, it's important to discuss the use of calcium 500 Vit D3 with your doctor. During pregnancy, doses of vitamin D greater than the recommended dietary allowance should be used only when clearly needed, so be sure to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so if you are breastfeeding, consult your doctor before using it. It's recommended to take calcium 500 Vit D3 as directed by your doctor or pharmacist. Always follow the dosage instructions provided on the label or by your healthcare professional. It's best to take it with food to help with absorption, and you may also want to consider taking it at a different time than other medications to avoid any potential interactions. When taking calcium 500 Vit D3, it's important to be aware of potential drug interactions. Certain medications, such as digoxin and phosphate binders, may interact with calcium 500 Vit D3, affecting how the medications work in your body. Additionally, calcium 500 Vit D3 can decrease the absorption of other drugs, including tetracycline antibiotics, bisphosphonates, levothyroxine, and quinolone antibiotics. Similarly, certain medications can also decrease the absorption of vitamin D. It's important to separate the doses of these medications as much as possible from your doses of calcium 500 Vit D3. Make sure to consult your doctor or pharmacist to determine the best timing for taking these medications. Furthermore, it's crucial to check the labels of all your prescription and non-prescription/herbal products, as they may contain calcium, phosphate, or vitamin D. It's important to speak with your pharmacist about using these products safely while taking calcium 500 Vit D3. Lastly, be cautious about using medications containing calcitriol while using vitamin D, as they are very similar and may interfere with each other. Additionally, calcium 500 Vit D3 may interfere with certain lab tests, potentially causing false results. Make sure to inform your lab personnel and doctors about your use of calcium 500 Vit D3. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, you should immediately call 911. Otherwise, reach out to a poison control center for assistance. U.S. residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Overdose symptoms may include nausea, vomiting, loss of appetite, changes in mental/mood, headache, drowsiness, weakness, and tiredness. When taking calcium 500 Vit D3, it's important to have regular medical tests to monitor your calcium levels. Make sure to keep all your medical appointments and consult your doctor for more information. To naturally increase your vitamin D intake, consider adding foods like fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish to your diet. Your body also produces vitamin D when exposed to sunlight. Incorporating calcium-rich foods into your diet can also help support bone health. Look for dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables such as broccoli, spinach, and bok choy. You can also opt for calcium-fortified foods like orange juice. In addition to taking calcium 500 Vit D3, you can reduce the risk of bone disease by staying physically active, avoiding smoking, and limiting alcohol and caffeine intake. It's important to follow your doctor's recommended dosage and take the medication at the best time for optimal absorption. If you forget to take a dose of calcium 500 Vit D3, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take double the dose to make up for the missed one. It's important to take this medication regularly and at the same time every day for the best results. Make sure to store calcium 500 Vit D3 at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it into a drain unless you're told to do so. Make sure to properly discard it when it's expired or no longer needed. For more information on how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.